Welcome back to Brashonomics. At the top of the hour, we discussed, ways people can try to make their lives better. And sometimes you're at ground zero trying to get to 100. And sometimes you might feel like negative 100 just trying to get to ground zero. Dr. Allott joins us, a naturopathic doctor, acupuncturist, and founder of Dynamic Paths, who really can help us understand a little bit about how people can feel and then the solutions that are out there, because there are so many solutions. You go online, you see solutions. You talk to your friends, you see solutions. Everybody is a doctor once they go on WebMD. So how are you, Dr. Allott?
I'm doing great, Ben. Thank you so much.
Well, my pleasure. It's good to see you.
It's good to see you.
So when people start to not feel well, they have so many options, don't they?
Oh, they do. Like, you can get online and decide that you're going to try supplements. You can go to your primary care physician. Sometimes people decide that they're not feeling well because they're depressed, and maybe they're fatigued, and that's depressed. And maybe they're fatigued and depressed, or maybe they have a chronic illness or something coming on. And sorting out where to start and where to go next is really challenging.
So how do people start down the path? Because as you said, there are different solutions. Some people go to their doctor. Some people might go, they think they, want a psychologist or psychiatrist, or they need to exercise more. They go to their personal trainer. They go to GNC. Who knows? there's a million different things. How on earth does somebody determine where they should go, and what do each of these people do?
Well, like we talked last time, I think it's important to find somebody to start with. And often good places to start are a primary care physician, a general naturopathic physician, an acupuncturist. Those are people who are really going to look at what's going on and start to differentiate out what the causes are. Because really, that's what you need assistance with. Because sometimes we have a story in our head on what the cause is, like, I'm stressed out because I've been working 100 hours.
Sure.
And that might be the only cause, but there might be other things that need to be figured out and maybe treated or problem solved around. Well,
it sounds a little bit like you're saying people maybe aren't going deep enough within themselves to understand what the problem is, and they want that quick solution that they saw on TV while watching last night, that, that's the pill I need, and people are real quick to get to that solution.
And that's a fine approach, actually, to do the quick solutions. The challenge is when you've done 6 of them and it's 6 months later down the road, and now, as you said, you're not only not at zero, but you're still well below zero, so you can't even get off the starting blocks.
Right.
Then what are you going to do? Because most of us actually don't seem to take action when we're just having a series of bad days. It's amazing how many bad days people will tolerate before they're like, crap, I got to do something about this.
Right. They go years. So you talked a little about this starting point, and that's one of the aspects of your practice. How do you help people as that starting point? What are some of the questions you're asking? What's some of the process you go through as that starting point?
Well, when somebody comes in, I'm looking at sort of 4 points if you look at a diamond, right? And up here, I think about the mind, which we all have, but you can't touch. And that's kind of software. And then I'm looking at the brain and the body, which work together. And do they have the nutrients and physiology to support all the thinking we have to do in our society? We're all employed because we have good minds, right? If we're employed, but we have to keep that optimized to keep that. And so, I'm trying to figure out when somebody comes in to see me is what they're doing helping or not. And then what do they need next? And sometimes they need to know a little more about their brain and body to optimize that and try to come up with simple, achievable solutions for that. Sometimes they need a good assessment of their physiology. And so I do a lot of blood work to say, you're anemic, or, you have hypothyroid, which is why you feel like crap. Let's treat that and see if you feel better.
Quit exercising.
And sometimes a primary care physician is going to catch that, and sometimes they're not. And so that's why I think primary care physicians are great, but it's not what I tend to offer or try to offer is sort of the whole assessment and then refer appropriately. Years ago, I had...
And you're talking physically and mentally. You're talking about blood work and some questions to be asked. And so there's more than just...
Physically, emotionally, mentally, really trying to come up with where's the blockage that's stopping somebody from thriving, and are there solutions within their life. And, yes, we all know we should be exercising an hour every day and getting 8 hours of sleep and all of those things, which we don't have time to do.
Right. And flossing.
And flossing.
We just, never mind. That's a whole other story.
And flossing and meditating and we don't, and then when do we work, right?
Right.
And so what I help people decide is what are the top 2 or 3 things that they can do in their lives that are going to actually make a discernible difference, and help them focus on when do we expect a return on investment, right? Because we're talking in a business, we want to know when we're going to get payback and for our time, money, and energy, right? And I try and be pretty clear about that, and what tools are available based on what the person's presenting.
Yeah. Dr. Allott joins us discussing naturopathic therapy and being really a naturopathic doctor in all the different ways somebody can help themselves, really help them.
Right.
There's all these different people you can go to, and you talked a little about how you start to maybe refer them down the right direction or down the right path in the right direction. What happens if they think, what happens if they determine that you're the person, you are the solution, and it's not the pills and it's not the maybe working out? I don't know if you double as a personal trainer, maybe you do. But, what if they determine or you determine that, hey, really, I am the answer. I am what you need. Or my services are what you need. What are some of the things that you do specifically?
Yeah. So because I don't have a crystal ball yet to psychically know what's
I
wrong
love that
with
you
somebody.
say yet, though.
I'm working on it. When somebody comes in, I have a series of appointments that we do together that are working towards each appointment helping you to feel better. And so the first appointment's 75 minutes long, and I go through an 8-page intake form, which just gives me a lot more information about you. And we talk about what's going on, and I'm like, hey, let's try this experiment. And I send you home with something that I think is going to help you feel better. And then somebody comes back and says, wow, this helped a lot, or it helped some, or not at all, which gives me an idea of what's happening. And then the next appointment, we do the same thing. I try and give a tool that's going to help with one of the things that's really pulling you down. And so part of the process that allows me to really see what's going on is we're kind of testing the system. And when we do that, things will flush up, and it becomes pretty clear if the main obstacles are physical, or if they're mental, or if we got some software virus in our head about what a crappy person we are.
Sure.
And the inner critic's always there, and sometimes it takes charge of what I call the committee, and and who's going to help you take care of that. And so sometimes I'm really appropriate, and I'm like, this is within my skill set, and I'm happy to keep working on with you, and things are getting better. And if not, then I'll say, okay, let's try meds, or let's try therapy for this, because this is beyond my skill set. But then the nice thing about coming to see me is you already have a second opinion on what should happen. And so if you need to go see a therapist, you know what you're going to go work with a therapist on, rather than, oh my God, I need to see a therapist and I don't want to talk about my parents.
Right. Isn't that where it all starts? When you were 9.
Right. I'm like, no, that might need to happen, but go work on this first.
Right.
And then, so you have somebody who's sort of watching that process. Or if meds are needed, I'm like, here are the classes of meds that are needed, and here's what I know about them, and here's the ones that are easiest to get on and easiest to get off, and I can help people work through some of their fears in both camps.
In some way, you almost are like this life consultant, it sounds like, where you can go through and bounce your ideas of your physical and mental health off, and you're able to say, you know what, this is my expertise. You need to go here, or work with me, or this maybe you need to go to see this person. Those seem like the tools you're talking about, or potentially other professionals. Diet. What are some of the tools that you?
Well, I really appreciate you that life consultant observation, because sometimes I really feel like that, in that I'm trying to give people the information that they need about their body and brain so that they can become their best selves. That's my bottom line. And no one has really given us a blueprint on on our particular physiology, on like how much protein do we need to be eating, how many carbs do we need to be eating. Am I somebody who should be exercising a lot or exercising a little? Like, those are really individual questions, and particularly at different times in our lives. And then we're just beginning to learn about the brain, but it's amazing how much time I spend explaining how brains work. And so when people come in for like a really important meeting, I'm like, okay, let's set up your brain so that it functions optimally.
Sure.
And wouldn't you do that with a computer? Make sure you have everything on board if you're going to do a big meeting. We kind of need to do that for ourselves.
Do you have PowerPoint loaded on the computer if you're going to give a presentation in some ways?
Exactly.
Dr. Allott, we just have about a minute left, but I want to, and maybe we can get more into this next time, but you talk about being your best self, and there's so many different aspects to that. When you start to focus on maybe one piece, whether it's physical or mental or work or family, does it tend to sometimes create this more rounded?
Yeah.
Is there a, I guess, a subconscious level or a unintended consequence of making everything a little bit better?
Well, yeah. So you understand intuitively the basic principles of the brain, in that when you change any one habit in your brain, they all change. And as a professional, we kind of know that, but sometimes we don't want to honor that or appreciate that. And studies are really clear, like exercise. If you start exercising, everything else changes just a little if you allow it to happen.
Sure.
And so, it's really that's why I'm like, just get started. Just get started. One step counts. And when you're ready for the next step, that counts too.
Yeah.
But keep plugging away at it.
Yeah. Well, we do have to go to break, but I would love to get more of your opinions another time on what are those steps, because, there's actually a great book by Darren Hardy I've been talking a little bit about the compound effect.
Right.
And it's just people want to go from A to Z, and they don't realize there's 24 letters in between.
Exactly. Thank you so much for bringing that up.
Yeah, absolutely. Thanks so much for joining us. Stick around. We'll get some more of your opinions. But before we do, Paul Pukas is going to join us next. We're going to talk a little bit about how jewelry may affect your home insurance. We'll be right back.